sweet friends. My name is Mela, and my channel is called Mela Yella. I had only planned on doing one video today, but I thought I'm going to talk to you guys while I get ready to do my second video about eyelid surgery. Okay, so if you don't need eyelid surgery, you don't need to watch this. And if you do need eyelid surgery, these things couldn't happen to you possibly, but it happened to me. And here's just some things that I think that I would have liked to have known beforehand. So in preparation for your eyelid surgery, I think that you should get these cloths called Erase Your Face, and they're really super soft plush microfiber towels, and you can, to wash your face after the surgery, you can wet them, squeeze them out. They'll feel completely dry, but you can rub it on your face, you know, leaving it partially wet, maybe a little partially soapy, whatever, and nothing will drip into your eyes because it's microfiber. So we'll just pretend like I wet this and squeezed it out just a little bit so no water was dripping and it was wet and soapy, and then, you know, take in and clean your face with it, and because you do want your face to be clean even after your surgery, so yeah, of course. So and then just take and rinse it good and squeeze it out, and then you can take and do this and dry your face with it, and it'll feel like it's completely dry, but because it's a microfiber, it'll get any water or any soap or anything that remains on your face. It'll remove it all. Then after your surgery, they'll give you a full tube. I only have a little bit left, but I have a second tube, but I use things till they're completely gone. So this is all that's left of my tube of medication. But it's an ointment, and yes, it does run into your eyes. It makes your vision blurry, so plan on not driving while you have the stitches in and need the ointment. Unfortunately, after she removed my stitches, this one came open. I don't know, it was bothering, I told her it was hurting me when she removed the stitches. When she removed the stitch, it didn't hurt at all, but I told her that before she removed the stitches that it was bothering me here. And I guess when I was sleeping that night, I rubbed it, and when I woke up it was bleeding. So I took a picture and sent it to their office. They looked at it, said that they thought it would be fine, just continue using this same as I was doing before, twice a day until it closed. And they had me come and pick up one of these eye shields. So I'm now wearing two of these because she said that I had rolled over onto my side and there was too much swelling. But if you look at these two eyes, this is the one that I originally was wearing this on. Look like a little bug because it's concave, but it's got the holes in it. So this is the one that I was originally wearing for swelling, and then I made this one bleed. So now I have to put this on the open wound. I call it a wound because I scratched myself, I guess. So if you scratch yourself and make yourself bleed, it's a wound. So I'm going to put this on the open wound, and now I'm going to leave it and it's fine. But when I go to sleep tonight, I have to put this on this eye and tape it because it's an open wound. And excuse me, I step out of frame for a second. My second one, this one they gave me when they removed the stitches, because she said that when I would go to sleep at night, I was rolling over and sleeping on my side, so now there's additional swelling on this side that has to go down, and so she gave me this. So when I sleep at night, I have both of these on, and even though they're clear, it's a little hard to see. and then tape them down. Look like a little bug, just need some little antennas. But be careful if you get up to use the bathroom or something, because your vision will be impaired. Not only from the ointment in your eyes, but from this not being, completely clear from this being on your eyes. If I would have known all this information when I went in, before I went in to have my surgery, I would have made sure I had this ready, and I would have made sure that I had a whole stack of these, maybe 2. I think you buy them on Amazon in a pack of 5. Erase your face. They're great for dipping in your big bowl of water and ice to put on your eyes this way for swelling. And you just squeeze out so that it's not too wet, but it's still wet and cold, and it doesn't, because these are so soft like air, it doesn't put a lot of weight like a regular washcloth would on your eyes, and it's real soft on your skin. So have a stack of these, 5 or 10, whatever you want to do, and dump out your water a couple of times a day to keep it clean. Every day get a fresh cloth. So here's the cloth. Then put your medicine on your sutures. Then when they remove the sutures, ask for these, because you don't want to do like I did. If this wasn't swollen, in a couple of days I would be able to wear makeup and this would be gone. But now I have this I have to deal with, an open wound, and I'm going to have to wait until this closes and goes away before I can wear makeup. So when you go to have your sutures removed, or even when you go in and you talk to the doctor and you're going to have it done, ask her for 2 of these. And that way, immediately after your surgery, you can put these on your eyes, because this will stop your eyes from swelling. You just tape them on, and that way if you roll onto your side in the middle of the night, you're not going to have any swelling, extra swelling happen, I assume, but you're also definitely not going to damage your stitches. And then after you have your stitches removed and your eyes look pretty nice and normal, I'm not talking about swelling, but you don't want to open this like I did here. So ask for these if you haven't already. And I tried sleeping with the opening here, so it was on my nose, and that worked out good until I got both of them. And then when I got both of them, the 2 were fighting in the middle. So now I just sleep with them this way, and then I put this tape over it. So I wanted to talk to you guys about that while I got ready to film my next video. I went in and seen the doctor in preparation of this, and she said that I definitely needed it, and she would send off a thing to my insurance company to see if I could get approved. And of course, it was blocking my field of vision. Otherwise, I wouldn't have done all this. And you may be as young as 20 years old and need to have this done for hooded eyes. It's not just like an old people thing. And I love this stuff. It's Elf's Halo Glow, and I like to use things up, but next time I get this, I am going to get it in a different shade, because I think this is a little bit too yellow on me, but I make it work because of the other products that I use. But I don't think it's too bad. I just make sure that I don't get any on top of my eyelid. So I'll rub this in. But yeah, I wish that, you're going to have a driver with you, and you're going to be a little woozy. As soon as I got into the prep room, I don't know, pre-surgery room, whatever they call it, I told them that I was nervous, and I asked for something to help calm me down a little bit, because I felt nervous. And so they went ahead and gave me a medication, and I don't remember anything, and then it was over, and then my mom took me home, and like I said, I did the ice water and the cloths on my eyes, 20 minutes on, 20 minutes off, and it really wasn't a big deal. For showers, you know, you could just take a dry one of these and, you know, try to be really, really careful in the shower and not get your eye wet so that you could clean the rest of your body, of course, for hygiene. And then just use one of those to wash your face, like I had said before. But I wish that I had known about these shields, so that I wouldn't have the swelling on this side, and so that I wouldn't have opened this one, because I have like 5 eyeshadow palettes to review now, guys. And I know you're kind of here more for eyelids than you are for makeup, but yes, I did just drop the brush. I meant to put it in my cup. I wish that I could say, I wish this was live so that I could like answer any questions that you guys may have at this point. But since it's not live and I can't do that, I'm now going to go have some dinner with my husband. I'm just going to take the shine out of this a little bit with a little bit of my setting powder that I got yesterday by Manicador in my Ipsy bag, my Ipsy Glam bag. I like getting those. You get some neat little things sometimes, and I do use them. I love getting them. It's $14, I think, or $14.99 for the bag, and you get, I think it's 4 products. You pick the 5th one yourself, and I picked this blush that I'm going to use today. It's a screw top. It's like you gotta unscrew it so that you can get it screwed right. Did I get it? Did it click? I think so. Alright. I also get the ice cream beauty bag. And I got this beautiful contour. Check this out. I think this was worth $45, and the bag is, I think, goodness gracious, $40? I'm not sure. For the ice cream beauty box, I mean. And it's beautiful. It's absolutely beautiful. Look at that. But I do put contour under my neck because it's hereditary. I can't do anything about it, so I'm just gonna go with it. But I just want to get ready for my next video that I'm gonna do. But my husband went and picked up pizza, and I can smell the delicious pizza, so I want to go have pizza with my husband. This was the other thing that I picked for myself, was the blush drops. They're from Urdile. Don't know if you can see the name there. I'm just going to put a couple of these on. It's got a little doe foot. It's kind of like a paddle, so I'm just going to do like 3 dots from this side, 3 dots from this side, and I'm going to use this little brush. I'm just going to blend those in. And they're wet enough, and I didn't put on enough powder where it's going to be an issue of it messing up anything. It'll blend fine with the powder. Alright, let's just put a little something on my lips, which I shouldn't do because I'm going to go have pizza. And what is this? I think it's Jared Cosmetics. All you can see is GC, but it's Jared, G-E-R-A-L-D, Jared Cosmetics. I think this color is called like Moonshine. It's really pretty, I think. And it's mousse. So, I'm not going to do liner or worry too much about it because, like I said, I'm going to go have pizza with my husband, dry my hair, and come back and do a video of eyeshadow palette. I hope you all have a beautiful day. I hope that your surgeries go well. I hope you don't have any complications with swelling or your site coming open after you've had your stitches removed. But if you do, be calm. Don't freak out. This needs to heal up, and after it heals up, there shouldn't be a scar. But if there is a scar, you and your doctor can take care of this after it heals. But just do what your doctor says and take good care of it, and you shouldn't have a scar. And like I said, when you go to sleep, make sure that you have this on so that you don't have the swelling. Sleep in a recliner, sleep with on your pillows elevated. I slept elevated with a big pillow on this side, a big one on this side, and I put my hair up when I sleep, so I slept with two pigtails with big scrunchies, hoping that would keep me stabilized, and I still managed to roll over on my side when I was sleeping. So I don't know. I wish I would have had both of these to wear with my sutures when I got my sutures put in, so that I wasn't going through what I'm going through now with the swelling and the wound. Alright guys, like and subscribe. If you have any other questions about your eyelid surgery, leave them below in the comment section here on YouTube. I definitely will respond. And I'm not a doctor, not a nurse. I'm just like you. I'm just somebody that had the extra skin and had to have the eyelid surgery. I hope you have a beautiful day. Bye.